Hey guys, ECRG here, back with another episode. Today I'm going to give my thoughts on the Clinical Trials Guru new book. It's called A Comprehensive Guide to Clinical Research by Dan Sfera and Chris Sauber. And for those that have maybe listened to the collab video the Guru and I did a couple months ago, maybe a month and a half ago now, it's up on the podcast, of course, and also up on the YouTube channel. You should know it because it has the thumbnail has the book cover on it. So we did a collab, and he was talking about his new book that's coming out and how it's really like a basis and a good starting point for those that are interested in clinical research, and for those that are maybe new to clinical research within their first couple of years. To kind of get a foundation and a basic understanding of what clinical research is and some of all the different facets that go into being a good clinical research professional. So Dan sent me a copy of this book, and I'm so grateful for that. So thank you, Dan, if you're listening to this. I really, really appreciate that. That was really, really cool. And so first off, I want to talk about what I thought of the book. It took me a while to read just because I'm not the best reader. I prefer audiobooks, and I know this book is going to have an audio component at some point. I know it is going to come out an audiobook, so that would have been my preferred method. Now, I know there's a lot of people out there who do prefer reading tangible books to audiobooks, and so you can get this book now. Currently, it's on Amazon, and I forget what the price was. I think it's under $50 if I remember correctly. But I do think that this book does exactly what Dan said it was going to do. It gives you a great basis for clinical research. I do not think that people who have been in the industry 5-10 years should read this book in any capacity, because I feel like a lot of the stuff that is in this book is for people that are new to clinical research. So I would definitely recommend to get this book if you are trying to get into clinical research. This would be a great book for you to have because you would understand a lot of the facets and the basics that you would get anyway within the first few years, but you would understand it before your interview. And I think that would actually help you get a couple more $1,000s when negotiating your salary, because you'd understand more than the average new person to clinical research. So I think it's for those people. I also think if you're within your first 2 years in the industry in clinical research, this book would be great for you to help you get a jump start on key terms, to help you get a jump start on the different aspects of clinical research. Because one of the things that happens is, let's say you get a new job and you're a clinical trial assistant. You tend to know the clinical aspect of clinical research and what they do, but you may not understand, what data management does. You may not quite understand the FDA's role. You may not quite understand, project management's role in the clinical research process. So I think this book does a really good job of kind of tying all that together and understanding what the common goal is for clinical research and familiarizing you with a lot of the different keywords and acronyms used in clinical research. So I think that's why this book is so great for those people that are new, because you're just not going to understand all that stuff up front. It's going to take a while to get. And I mean, you would get it, but I mean, even me being almost 4 years in the industry, 4, maybe 5 years, there's some things I did pick up from this book that I think would be important. Some of the other things that I really liked about this book were it is easy to read, even though it took me a while to read. That's just because I don't have a lot of time to read in my schedule. So my reading time is on flights. And it just so happened after I received the book, I put it in my travel bag. And, the flight I had coming up were to New York. And it was a very short flight, an hour or less. So, I didn't really have much time to read. And, I was doing that for a few weeks. And so I did get through a lot of it each session. I think it probably took me about 3 hours to read in total. So it's a very, very quick read, very short read. And, the text is nice and big, so it's easy to read. There's also a lot of tables and charts throughout the book, too. Like, for example, I just opened up a random page. financial disclosure forms. So they talk about financial disclosure forms in the 1572 and blah, 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 blah. So they actually show a picture, a template of what a financial disclosure form would look like. Very helpful if you have never seen one before or even heard what that is. So they've got a lot of full page charts. They got an FDA 1572, an example of what that looks like throughout the book. When they talk about ICH GCP, they've got a diagram of the 13 principles of ICH GCP. And that takes up basically a full page. When they talk about monitoring visits, they've got diagrams and copies of what a monitoring visit report is going to look like, or an annotated report is going to look like. So, very useful. It's going to show you what these things look like. And I love that. It's not just text. Makes it easy to read, makes it easy to get through, but also is going to show you. And a lot of times showing you is better than you can be told. I would definitely give this book a 5 out of 5. It does exactly what it set out to do. And Dan told this when he came on the podcast. It's not a book for experts. It's not a book for people, even intermediates, really. It's not a book for those people. This is a book for people that are new to the industry and that are, just getting their start in clinical research. And I think it's exactly for that. It does a great job. A lot of this information is on the internet. I mean, I've done videos on a lot of these topics. I know Dan has done episodes. I mean, he's been doing this way longer than I have. I know he's done episodes on probably all of these topics. But it's nice to have it in one concise manual, if you will, one place that you can just pick up and read whenever you need it. I think this is something I definitely might reference in the future for, just spurring up video ideas, or just if I have a question about something. This is definitely something I could see myself referencing in the future. Now, I want to talk about specifics of the book, or a couple specifics of the book that I thought were very, very important. And one is going to be in the back, where they have a list of acronyms. Let's see if I can find it. I was looking to, they have a list of acronyms. So that's good. Common and useful. Yeah, they have a chapter. The last chapter is a bunch of common and useful stuff. So they got acronyms. Once again, you're going to pick these up as you work in clinical research. So it's not important that you sit there and memorize them or anything, but it's there for you to reference. Another thing I thought was good was they have a list of positions in clinical research, which by no means is it complete or anything. I mean, that'd be crazy to list out all the positions, but the main ones: in-house CRA, project manager, TMF specialist, clinical trial assistant. They talk about the pay and they talk about exactly what they do. So that's very high yield, and I think could be very beneficial for people that are looking to get into clinical research industry. I talked about the diagrams for important essential documents and things of that nature. They talk about the different studies. They talk about the different phases of clinical research. So overall, this is a great book. Really, really great book. And, if I was just graduating college or, just trying to get into clinical research right now, and Dan was talking about this book, I'd probably be a little hesitant because, it is almost $50, or I think. But I would have been very, very glad to have this book. This is something that I think definitely would have helped me early on in my career, and definitely helped me prepare me better for the interviews, because, they might have been asking questions and you really would wow someone if you knew some of the background knowledge. And some of this knowledge is not easy to find on the internet, even though it's out there somewhere, but sometimes it's not obvious. And especially if you're looking up something about an acronym, those aren't necessarily out there, and tons of other industries may use the same acronym, but obviously it's going to mean something way different. So this is a great book. So I'd give it 5 stars for sure. Strongly recommend. And I think Dan and Chris, they did a great job writing this in the way that it was written, because, it's written very easy to read. It's not super, super complicated text where some books can get like that. It's not written like a textbook. It's written like a book that you can just pick up and casually read and still enjoy yourself while learning about clinical research. So I appreciate that they put this book out there. And, I hope maybe they'll come out with another edition or something more in depth for us people that are a little bit more advanced in clinical research later. But as far as, somebody new to the industry or just getting their start in the industry, I definitely recommend that you pick up this book. Definitely recommend. So that's it for this episode, guys. Thanks, Dan, for sending over a copy of the book, and it's autographed, so I really appreciate that. And this is definitely going to go on the bookshelf. My bookshelf isn't too heavy right now. I don't have a ton of books, but definitely the ones that matter I do have, and I definitely keep this around. So thanks, Dan. Thanks, everybody, for listening. As always, email me eliteclinicalgroup@gmail.com if you have any inquiries, want to do the resume review program, want your LinkedIn profile reviewed, or want some interview preparation. Email me eliteclinicalgroup@gmail.com. Take care, guys.